Incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell, and many more. We have not forgotten to include within our health hours the many societal, cultural, religious and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you and we want you to use the time to listen, learn, share your experiences and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@carn.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community. CATHIB is funded by the National Lottery Community Fund.
Well, hello. Welcome, everyone. Today is a special day. It's Windrush Day, a day when we remember the Windrush generation and Caribbean people who came to the UK and founded such a wonderful heritage. So we at Carn are celebrating today at Alexandra Park in Manchester from 12 to 6. So we're going to be live streaming the health hour. It's free entry. There's live music, food, children's activities, sports, and much, much more. So do please join us if you find yourself in the Manchester area. Now, today, I'm so delighted to have with us Dr. King, who is a consultant physician in neurorehabilitation medicine at King's College Hospital NHS Foundation Trust. Her special interest is in acquired brain injuries, and she is service design and clinical governance and improvement lead. She's also a department education lead, and she's worked to develop the education offer for medical undergraduates, postgraduates, and other allied healthcare professionals. So we're very lucky to have such an expert here with us today, and we're delighted to welcome Dr. King. Dr. King, thank you.
Thank you so much. That's a really, really kind introduction. Very, very pleased actually to be talking about such an important topic to me, which I also hope will be of great interest to everybody. As mentioned, my work is in the neurorehabilitation of acquired brain injuries in particular. That's my particular interest. But today I thought, before I speak about acquired brain injuries, what they are, their impact, maybe to start off just a little bit talking a little bit about brain health, because if you think about it, before something is injured, the impact of that injury might also, like how the initial starting point, the health point before any injury will have some impact. So just to run a quick run through of what I'm hoping to be able to cover in the hour. It's a really huge topic. So this is a little bit of just some key points within a little bit of what is the brain, what is it like, and how does it work optimally, and then what do we mean when we say a brain is healthy, and what can we do? Because what is very important is that we need to think for ourselves. It's like what are the things that I can do that could be improving my brain health. And then I will talk about acquired brain injuries, because I think this is something that is really important. It affects, it can happen out of the blue. A lot of the time it does. And then having some awareness of what happens with an acquired brain injuries, the impact of it, what to expect of it, and how to navigate or support those with an acquired brain injury would be helpful. And hopefully bring all of those things together towards the end, and hopefully have time to address anything that has come up that people might want to know in a bit more detail. So when we think about the brain, it's actually, for me, what interested me about the central nervous system is that the brain actually really, it controls everything. It controls your conscious level, how you react to things, your learning and your movements, and it is connected to the rest of the body via the spinal cord. And then from the spinal cord, you get all the nerves going to all the different organs in the body, right to the tip of your little toe. And then those nerves, if you think of them, they're kind of, so I'd like to think of it a little bit like the brain is, the command, the central command, where it really interprets all messages that come to it, and then really has the executive decision making and the function of it. So messages from your brain, or the nerve impulses, would travel down the spinal cord, which I think of it as being the second in command, and then to then coordinate all the different activities of the body. Even as I'm speaking now, some of my impulses are in the brain is drawing on what I know, what I have stored, controlling my speech and my ability to kind of like be interacting with you on this platform. And if you think about all the sensory functions that you use every day that keep you safe, things like touch, temperature, so that you know not to go into something that is too hot, or your vision, all of those things are really coordinated by the brain. And then this is just a little bit of a cartoon illustration rather of what the brain is like. And we really always have to remember that the brain, I'm talking about the adult brain, it sits very, very protected in a skull encasing, which is a very strong bone, as you can imagine. And there's no space really in that. So it's really encased in it. And it is quite a very, very delicate organ. And then those are I was just showing just a few main bits. Where it says cerebrum, that just refers to all that area that is represented in yellow. That is the biggest part of your brain.
Sorry, Dr. King, sorry for interrupting you. Please, if you don't mind sharing the screen so you can see the presentation. Thanks.
Oh, my apologies. I thought the screen was shared. I'm awfully sorry. Are you able to see the screen now?
Yes, we are.
I'm so sorry. I had thought that you were able to. I don't know if you'd been able to see that brief overview, really, which I had talked through that slide of what the brain is like. Thank you. Thanks very much for that prompt. And then, yeah, on the screen now, hopefully you can see the depiction of a brain, which is really an artist's illustration of it. And the biggest part of your brain, that does a lot of the major functions, is the cerebrum. And then you get the cerebellum, which sits at the base of your skull, right towards the end. Sometimes people ask which part of the brain is more important than the other, but really there isn't one that you can really kind of like not do without. Although we look at all different brain functions, a lot of them are very interconnected. A lot of the time people will hear about the brainstem, or might have heard about the brainstem, mainly because if the brainstem is injured, depending on which area of it is injured, it can affect people's conscious level. And so that might have come up in different discussions or films. You might hear people talking about brainstem death, that sort of thing. But that's where it sits. But again, it is very interconnected with everything else. You might have heard a lot of the time people do talk about the right hemisphere or the left hemisphere, mainly really referring to the right or left side of your brain, because that big area that I said is the cerebrum. The brain sits with many, many folds, and it sits, again, as I said, within a skull shell, but it sits within a very nutrient-rich, finely tuned liquid called the cerebrospinal fluid. And then these halves are not separate. It is just kind of like they do two different main areas of preferential work, but really with a lot of interconnections. So they don't sit separately. I will talk a little bit about these main areas because a lot of the time people do hear about the frontal lobe a lot, because the frontal lobe tends to coordinate mainly things like your motivation, your personality type, and things like managing your behavior. It's kind of like the last guard. You might hear sometimes people saying you being a bit frontal, meaning that you being a little bit disinhibited. So it tends to do that last layer of inhibiting some of your behaviors, managing your personality, your motivations, but it is also interconnected with learning. Sometimes people talk about the parietal lobe, which has quite a lot of function to do with things like language and interpreting a few different aspects of learning. Again, all of these are interconnected. I'm just talking about the main areas that they might do. A lot of the time, the temporal lobe sits on your temples, as it were, that people hear about. And it has a really, really big role in learning, executive function, and then what we call cognition. And one aspect that, just to always remember a little bit about the temporal lobe, is that it's quite interesting. I find it very interesting that the way it sits, it's quite vulnerable to injuries, but then it also tends to, if it has any scarring or any injury, it tends to really, seizures tend to be really easily triggered if you have scarring of the temporal lobe. And then you'll see that occipital lobe right at the back. It has a really huge role in interpreting vision and learning that is related to vision. So you might, if you get some injury on the occipital lobe, it is very highly likely that your vision will also be impaired, or how you interpret visual images might be impaired. Again, as I said, this is very general terms of just describing. It's a very reductive way of describing what the brain does, just to give you a little bit of an aspect. And the cerebellum, which is right at the bottom there, and the most well-known function of the cerebellum is balance. People tend to think about it as in terms of really being the part of the brain that if it is injured, people really have difficulties with balance. They have a gait or a walking pattern that almost looks like you are drunk. And then another aspect that I always try to remind people of is that, again, it's very, very involved in learning and in judgment. And it also has a really huge role in kind of like learning about maps and topographical learning. The reason why so many people knew very early on that its function is involved in balance is that, and don't ask me why this is the case, they found that in dancers, especially people that dance and have to do balance motions, when they did postmortems, they found that they had a really enlarged cerebellum. But that's just a little bit of interesting thing. I've put up this slide to just say, to remind, as a bit of a reminder, or I rather like to remind myself, that the brain, when we think of the brain, we really have to also remember that it's a vascular structure, that it has a lot of rich blood vessels going through it. And it is the organ that needs the most amount of what is supplied by, what comes with the blood supply. So this is really kind of like a scan, an MRI scan that showed, that was done to, this is the gray things that you see, it's because there's a dye that enhances those blood vessels. And the reason why I put this up, different images of it, is that to link, when we're thinking about our health and thinking, the brain really benefits from having good circulation, good nutrition coming to it, good amounts of oxygen, then what we also need to do is to remember that those things are supplied by the blood supply, by the arteries that come to the brain. And any waste that needs to be taken away or metabolic waste needs to be taken away by really good, healthy blood vessels. And that will come into play. I'll refer into it again when I talk about how you can look about your brain health. So I would say this, wouldn't I? Because I would say that brain health is very important because it is an area of interest of mine. And although I have to kind of like really touch upon a few basic functions of different parts of the brain, it is an incredibly complex organ. And much as we probably have made huge advances in neurosciences, colleagues of mine that work in neuroscience research and some of neurology colleagues would even be able to talk a little bit more about the complexity of the brain structure and its function itself, is that you then have to really think that something that is that complex, you need to, and because it is, again, as I keep on referring to it, that it is the command center of all your systems, of all your conscious and unconscious functions, and all the function of interpretation of all the senses that you have, whether it's your vision, your hearing, sensation, all of those things. It has to interpret them and make sense of them, and then make judgment out of them, and then also control your movement. And then in another really important thing, when we say cognition, we're just referring to the thinking, the judgment, the planning part of your brain. And then another important aspect of what the brain does, or its main function, is your mental state and your emotional processes, how you react to situations, things that either might make you very happy, the excitement, or something that might make you feel a little bit more anxious or frustrated. All of that happens in the brain. And then another really important thing, we all are from very rich, different cultures that all come together. And we would have, from a very young age, started learning behaviors. And all of those behaviors that you learn, and what is socially acceptable and what isn't socially acceptable, that is part of what your brain does. And then that is what we call behavior and social cognition. So there's different various definitions of what brain health is. This is one from the American Centers for Disease Control and Prevention, where they have said, if your brain is healthy, it should really have the capability and the ability to perform all the mental processes that it is demanded to do, all the cognition, and it should still have the ability to learn and make judgments, to use language, and then also to remember key things. There are other definitions. I'm just giving you a flavor of it, but they really all center around the same things, that if your brain is healthy, it should be able to do all the optimal functions that it needs to do, all the mental and cognition function, and given, what would also be appropriate for your age, really. Because again, you as you can rightly imagine, that if you are a 5-year-old, what do you expect your brain to be able to do at that age, and what learning it has done would be very different from if you're in your 60s, what you have learned and what you are able to draw upon from terms of your experience would be very good. So just a little breather. If I then look at, so what can you do? And in terms of what you can do, some of it will come as no surprise to everyone. People will be like, yes, I already knew this. But I'm hoping to add a little bit to that to say, why is that important? I did refer to the brain needs optimal nutrition. It needs optimal oxygen, and also the right sort of elements come into it, which is why I was giving you that picture of that vasculature, or the blood vessels that go to it. And when we talk about nutrition, you have to then think of what nutrition might affect those blood vessels in a negative way. If your blood vessels become clogged or partially obstructed, then they will not deliver things optimally. If the blood vessels become vulnerable to things like very high blood pressure or causing a problem, then they will not be functioning optimally. Exercise is a very good thing because, again, exercise in that, if you think about exercise, it's not just the physicality of it. It is the fact that your brain during that time is concentrating on things like movement and other things, and that enhances its function in those domains. Stimulation of your brain, we all know that if you do lots of learning or just keeping your brain active, that is a very reasonable thing, because that is what it does. So you're basically doing mental exercises. Different people enjoy different things. It doesn't have to be Sudoku all the time. It is just the aspect of learning different things. If you're learning how to knit, your brain has to do that. It has to take in the instruction. It has to remember the sequencing of that instruction. And it has to then coordinate the movements that you do. If you're learning to cook, that is mental stimulation. If you're learning, I don't know, maths, if you want to learn maths and do something so that activity of keeping yourself in a state of continually learning different things and different skill set actually stimulates your brain. I would like to talk about exposure to toxins, because I think that is a very important thing that we'll come to when we're talking about brain injuries. There's different types of toxins. Some of them you might not be able to have any influence on. If it is something that is environmental and it is related to pollution, you might not have as much control in terms of that. But if you think about things like, and I have to mention this because it does come up, if you are in an environment where, say, for instance, there is not enough ventilation and there is more carbon monoxide than anything else, then that actually is an exposure to a toxin. It is not kind to your brain. Other types of toxins might be pharmacological. When I say pharmacological, I'm including prescribed and non-prescribed drugs. I am not saying, and I have to stress this, I'm not saying do not take your prescribed drugs, but you need to be able to have discussions with whatever clinician is making a prescription and be aware of what the possible side effects are and what the positive effects of them are. The other thing, which some people might take recreational drugs. Recreational drugs have no benefit whatsoever to your brain, and they pose a risk. There are many people that might have a more sudden, abrupt, very obvious injury that is related to a pharmacological agent, such as stimulants or cocaine or similar things. But other people might have slower exposure to pharmacological agents or recreational drugs that actually will affect their brain health. There is a reason why people drink alcohol, why we all drink alcohol now and again. Alcohol has relaxing and slowing down aspect of your brain, but sustained alcohol intake over recommended limits over time is very harmful to your brain. In fact, there is a very specific brain related injury that happens as a result of chronic alcohol intake, and some people might have heard of it. It's called Wernicke's encephalopathy. And that is very specific brain injury that happens from sustained alcohol intake. We all are aware, and I think the public health message of smoking has been drummed long enough. We've heard that beat, because what smoking does, the way that it affects, other than the other toxins that would affect how the brain works itself, that are contained in smoking, it also affects those blood vessels that I was showing you earlier that go to the brain, which means that actually then they're not optimally functioning in what they need to do in order to deliver the right circulation to the brain. I always mention health and access to healthcare, and being aware that if you have any worries or any concerns about how your brain might be functioning. If you're thinking, I'm not sure if I'm remembering things okay, I'm not sure why I'm having these headaches, I am not sure why my vision is not working, I'm not sure why something that I think might relate to how my brain works. And being able to access healthcare is quite a key thing, and being able to access the right expertise and get the right advice actually does affect people's brain health. I've put the last bit where it says, where I mentioned including health screening. There are some conditions that are genetic or that may require that other members of the family or other people that might need to be screened are screened for that. So if you don't have access to that, that of course would likely impact your health in the longer run. Socioeconomic factors, we cannot, we have to be mindful of those very, very much so, because if you are economically able to optimize your nutrition, be able to have time to exercise that affects you, if you have other life stresses that really affect how you sleep, because sleep is a hugely, hugely important thing for brain health, because there's a reason why lack of sleep or keeping people deliberately awake is used as a torture tool. And in fact, actually, I went to a recent exhibition at a science exhibition on kind of like brain health. It was aimed at all of us to just appreciate it. And I had a really helpful reminder that they said, we still don't understand enough about sleep, but what we definitely know is that prolonged impaired sleep, or if you don't get good quality sleep, does affect your brain health. And then something that was additionally mentioned at that exhibition, which I found interesting, was that if a living structure, a human being was kept deliberately awake for a certain period of time, I can't remember the time, I'm terribly sorry about that, that actually it could result in death, which I thought was quite striking. And so it's something that's very, very keen to think about. I always mention blood pressure. Blood pressure is something that I know it gets over mentioned, but it's a very, very, very important to get screening for blood pressure. The importance of the reason why I stress it as part of brain health is that you can exist quite contently for years with blood pressure that is higher than normal. And that blood pressure causing very slow harm to you and also subsequently potentially to your brain without you knowing. Because the way that if we all think of our blood vessels, again, that's why I refer to those blood vessels in your brain. If you think blood vessels going to the brain have to go at a regulated good pressure in order to do their job well, so that that blood is delivered at the right pace to the right brain tissues, and then it also moves around, moves the right thing back to the lungs at the right pace. If that blood is traveling at a very high blood pressure in those blood vessels, it will harden them, and then they would not work as well. And then there's always the risk that that blood pressure might be so high that it actually might cause one of the blood vessels to burst, and then you might have something called a hemorrhagic stroke. So if you take one thing away from today, is that, do you know what your blood pressure is normally? And do you know whether that blood pressure is a healthy blood pressure or not? This was just me again drumming the drum about smoking. I will move on to acquired brain injury specifically in a moment, just checking the time that I've got. I thought I'll put up this data about the 10 leading conditions that impact brain health. And that first one, stroke, is by far a very leading condition. It's, to say leading sounds like something that's good, but stroke has huge impact and on the brain, and it's more common than we think. And sometimes there is a misconception that actually stroke is something that affects older people. I beg your pardon, older people. But stroke is a disease that could, or sorry, an illness or a condition that can affect anybody at any age. If you've got a brain and you've got blood vessels going to your brain, stroke is a possibility. The neonatal encephalopathy, really, that's something that affects young children at a very young age. I have put migraine there, which was in the statistics as being a third leading condition that impacts your brain health, is because actually migraine is debilitating. People that have really awful migraines will know that it can take days out of your week, and affects how you work and how you live your life and how you enjoy the activities that you want to do. And then also, more importantly, migraine has been found to also be at risk for stroke. The fourth one is a huge condition that I think it's when I say, I've deliberately put dementias because there's different types of dementia. And dementia, people will be aware, is a condition that, or it's a group of conditions that gradually affect things like how you think, how you problem solve, and your memory. And people tend to remember the bit that dementias affect your memory a lot, because that is the first noticeable thing. But another thing about memory, the function of memory, is that the reason why you remember things and you can refer to them is that it's your ability to learn. And it's your ability to socialize, and it affects your ability to problem solve. If I give you information that actually the cheapest, the cheapest groceries are at Tesco's, and we are about to go to Tesco's, and you're not able to retain that information, it can not only be distressing, but it will impact how you function, because you'll be like, where do I get groceries again? Where are they, and why am I supposed to go there? So how do you problem solve, and how do you plan? There's lots of, sorry, I said lots, there's different types of dementias. That in itself is a talk on its own, of the different types. I've mentioned diabetic neuropathy, because diabetes, very, very common condition, and how it is controlled and managed actually is another thing that can affect how your brain works. Again, very quickly think about the fact that diabetes affects, it's a condition that is to do with blood sugar control, and if your sugars are persistently high and in your blood vessels, it also affects how your blood vessels work, and then puts you at risk of numerous different things, including how your brain works. Meningitis, that is a general term that refers to conditions infective conditions more commonly, that would affect the lining that covers your brain, the meninges. So itis is just inflammation. So the meninges, i.e. the linings that cover your brain, and then if they have an infection, meningitis, and then if you get swelling in the brain, then that can cause an injury. Epilepsy is a condition that really can impact how your brain works, and then its health. And then there's other conditions that obviously refer to how the brain works, but those are congenital. And then other systems, as we know, cancer can affect any part of the body, including the brain. I have referred to this a little bit, but I will make the separation of what is acquired brain injury. It's really in the name. Acquired, it means something that you didn't have before. So you didn't have it at birth, it's not congenital, and then you have acquired it. It has happened since then. So your brain has now acquired an injury. And how does that happen? Cerebrovascular diseases, cerebrovascular meaning blood vessels going to the brain. So any diseases that affect those blood vessels, particularly things like stroke or any inflammation of those blood vessels, will affect how the brain structures are and damage them. Traumatic brain injury, quite common, and usually quite, sometimes I think people don't realize that you punch somebody, the consequences of that. Also, if somebody's pushed, if they fall, or anything hitting your head with such force, or your head hitting something with such force, that skull doesn't manage to protect it, can give you a traumatic brain injury. And as I mentioned earlier, malignancies or tumors can also affect the brain. The functional brain disorders, again, that would be an entirely separate talk to talk about things that sometimes that disorders where you can actually detect what is being destroyed by within the brain structures. So neurodegenerative means the neurons in the brain gradually degenerate, or gradually you lose some of them. And that would include things like Parkinson's disease, Alzheimer's disease, and similar ones. We all know that psychiatric illnesses do affect how your brain functions, don't we? So if we remember that the brain functions, we talked about cognition, we talked about social cognition and behavior cognition. So things like schizophrenia, it's a condition where how you interpret and, like sensory input and everything else is completely impaired. And then depression, bipolar disorders, and alcoholism, and that sort of thing. So those fall under functional brain disorders. And then there are other brain illnesses. I think I mentioned migraine and how it is very debilitating. But actually, so far, I would say neurosciences or medical sciences or health sciences has been limited in actually maybe detecting what is actually the structural abnormality there. Right, so still got a bit of time to talk. Actually, now I will talk a little bit now about acquired brain injury. And as I mentioned, what is it? It's really an all-encompassing term that really refers to things that have injured the brain after you have you've been born. It's not congenital, so you've acquired it afterwards. And the two broad categories of acquired brain injuries are the traumatic, which is, as mentioned earlier, it's an external force or trauma that happens to the brain, and then you end up sustaining brain tissue damage. And then you can have non-traumatic acquired brain injuries. And the reason why I might spend a little bit more time on traumatic brain injuries, actually, that usually has the much more higher incidence of acquired brain injuries than the non-traumatic ones. So giving you a slightly more explicit examples of what traumatic brain injuries are. A lot of people might hear about concussion if you play sport, or people that play sports, or children, or if you're aware of more famous examples. I was talking to much younger colleagues recently, and I said, if you repeated concussion can have some adverse effects. Does anybody know Muhammad Ali? And a few of them looked at me, and I realized that actually they were too young to know him. But I think he's such a legend that he spoke openly about the repeated injuries that he sustained during a professional career in boxing. So not all of us are professional careers to that very, very extremely high level, but concussion really, if you think it's a sudden strike or whip to the head, that would cause the brain, because the brain actually, when you think of it, it's quite a very squishy texture. It's not a very robust structure on its own. It's very soft tissue. So it's really protected by the skull. But things that cause the brain to move, your head to move very quickly at force, mean that actually your brain moves within it. So if you think, sometimes if you see these things in slow motion, like a sporting thing, or somebody being punched, you can see the head move very slowly. And in that sudden movement, if you see it in slow motion, that movement, you can then imagine that movement in the head. So that causes concussion. And sometimes people are stunned for a few minutes. You might see it in footballers, you might see it in a sporting thing. But a lot of the time, people then seem to recover their usual function. And if you don't have repeated concussion, a lot of the time, it's fine. It's a very mild thing, and then you get on with your life. However, you can have something a little bit further to that, where now actually there's been enough force that you cause a hematoma, or hematoma just means a blood clot. And that hematoma can sit in different spaces of the lining of your brain. It can sit the arachnoid and things like epidural and subdural. That's just the layers that cover your brain. So that could be as small as maybe bruising. So the bruising really means that there isn't that much blood in it, but there is still blood somewhere. Or there could actually be a bigger hemorrhage where it's a bigger clot or a bigger hematoma. And you can sometimes have, really tragically, you can have penetrating brain injuries. The horrible case where some people might use very sharp objects with such force that it penetrates the skull. And that is sometimes usually in very violent combat, or in some instances, if it is things like a road traffic accident where actually maybe something has hit the force so much so that it penetrates the skull. The fourth point I was going to put there, but it's very specific to the military in combat or in war zones where it's blast injuries, where there's such a huge blast that actually maybe people are thrown up and then they come down. Still in the acquired brain injury category, non-traumatic brain injuries are things that would include infections. I think I spoke earlier about meningitis or meninges. There's also other infections called encephalopathies. People tend to recover sometimes, not all the time. If somebody recovers from that infection, physically, their movement and the ability to move around is usually relatively well preserved, but then it's really then their cognition, that is their thinking, their memory, and their problem solving. Anoxia, again, referring back to the fact that, as I said earlier, the brain needs a lot of oxygen. It needs a lot of glucose. It needs a lot of nutrients and minerals go into it. So an anoxic brain injury is when, for whatever reason, the brain is starved, either a part of the brain is starved of that nutrient supply. So anoxia really mainly refers to the oxygen part of it. So if the brain has been starved of oxygen for a particular time, then you get a hypoxic or anoxic brain injury. Stroke really is a big factor in non-traumatic brain injuries. There are two main types of stroke. Stroke just refers to circulation to the brain has been interrupted, either because a clot is blocking a blood vessel, or the blood vessel has burst, meaning it has hemorrhaged. And then again, within the non-traumatic brain injuries, we spoke a little bit about alcohol and drugs. And then another major cause is if you have a brain malignancy or brain cancers. And I'm terribly sorry, I'm aware that I'm speaking a little bit at speed. And then also I now have a very busy slide. But the ABI is just the acquired brain injury. Etiopathology just means how has that acquired brain injury happened? It's just referring or summarizing what I was just talking about earlier. The tumors, trauma, where you have acceleration, deceleration injuries, penetrating injuries, concussions, stroke, ischemia or hemorrhage. Ischemia means that's when the blood clot is blocking. Hemorrhage is when the blood clot has burst and then there's blood. The hypoxia or anoxia that I referred to. And then, so it's essentially summarizing everything that I was just speaking to. And then just also mentioning that all of those aspects, you can see the black arrow, hopefully, that they can affect any brain area. You remember when I spoke about all those different areas of the brain in general terms, that the frontal lobe, it does that executive function, the thinking, the organizing, the problem solving, but also the inhibition, disinhibition, and monitor a bit of your personality. If it is the motor sensory cortex, which covers most of it, your movement and sensations will be affected. Spoke about that bit, about the occipital bit, so it controls mainly vision. The brainstem, we spoke about how it controls your conscious level, but it also controls actually your breathing centers and things like your heart rate. Spoke about the temporal lobes. So if they're affected, the things that you can see going will be memory, your ability to understand things, language, and then other aspects. So again, the related complications all in green. If your brain is injured, if you have an acquired brain injury, other than the brain region function being affected, you can then also have complications following that. Some people can have really difficult to control headaches or complex migraine. If the brain part that is affected mainly is the one that affects consciousness, you can get something called locked-in syndrome. Sorry, that's slightly different. I was going to say that I don't know if people are aware of locked-in syndrome, where people actually are conscious and aware of everything that is happening, but they cannot move or use their motor. So, but they're functioning, they're able to understand everything that is being spoken about and everything else. And then there's also different things like your memory loss, other complications might include seizures. Also, all of those things that are in green refer to the different things that could be affected or could be the complications post to brain injury. So I will just, in conclusion, a little bit, or sort of like summarizing it up, I think I did speak about traumatic brain injuries. In high-income countries, the main cause of trauma is usually falls, particularly in the elderly, or maybe some road traffic accidents. Low and middle income countries, they are disproportionately affected by TBI or traumatic brain injuries. Most of those are caused by road traffic accidents. And that just illustrates a little bit in color. I'm terribly sorry, I don't know if you can really see it. The red is really where there's very high rates of violence causing traumatic brain injuries. Where it is dark blues is mainly falls that have caused traumatic brain injuries. So really trying to summarize and round up a little bit. So this is kind of like when a brain injury happens, what affects your outcome? Get into hospital quickly, getting the right treatment quickly, and then also having access to rehabilitation so that you can not only look at your physical aspects of it, the cognition aspects of it, and the emotion and behavioral. Poor outcomes are usually affected by if you don't have access to all of those things. So in conclusion, I hope I've interested people enough into brain injuries, the complexities of them, and that hopefully in future, or you might be able to remember some aspects of this, spread some awareness and support people that are affected by them, and then also look to see how we can make our communities healthier and safer. Thank you very much for having me. I've got some useful resources to share with everyone. Thank you.
Thank you so much, Dr. King. That was really interesting. And I know that I have even learned some things and found that really helpful. We have some questions. So people have been quite interested in this topic. So someone's asked, I'm very interested in brain health. Do you know if I can ask my GP for a brain scan to understand my personality better? I struggle with depression and wonder if it's a connection to my physical brain and not just my mind. So we'll just pick up on that. I'm just gonna and then someone else has asked about saffron and its help with brain health. I'm wondering if it can help and if it's something because it's a bit pricey. She wants to know. She's already taking vitamin D and omega-3. And someone else has asked about her son practicing martial arts, and she's worried about brain change from that.
Okay. I'll take those three, and thank you very much, actually. The brain scan, a lot of how your brain functions, you can tell from what you do, because the brain essentially, as I said, controls everything. So brain scans usually are used to get a little bit more of an idea of what has been injured and what is structurally needs to be looked at. So if you are looking to understand kind of like how does your brain work? What is the cognition aspects of it? What is the mood aspect of it? If you do have access, unfortunately, access to neuropsychologists is very, very hard because there's very, very few of them. But they usually do very high level, detailed cognition testing, as well as looking at your immune mood and psychological aspect of it. What I like to try to also just remind people is that your structural brain and how it works functionally is not separated. You know, our psychology or our mood and everything else is not really separated from other aspects of what your brain does. So my suggestion is that if you have access to a neuropsychologist, which I know is they're rare, they usually would do a much more better job of looking at how is your brain functioning and what is a mood element of it, depression, anxiety, any other aspect, rather than a brain scan. The brain scan would not necessarily be that helpful.
Thank you. And I think it's also important because, you know, as you say, just a normal brain scan, a lot of this neuropsychiatry work is still very much in the research stage. So accessing that outside of research context is not really something that is really accessible, particularly on the NHS, but even in the private sector, because we're still really working on understanding those connections between how the brain works and mood. So watch this space, but a simple MRI or CT scan is not going to really tell you much about your mood.
Yeah. And with relating to nutrition supplements, I think somebody mentioned saffron.
Yeah.
There's a lot of talk about saffron being helpful for things like memory benefits and everything else. I think given that its price is also quite limiting for general use, and also I don't think it has been, I'm not aware of detailed literature or research that has looked into it. What I would suggest, or what has been looked at in more detail, is things like making sure that vitamin B and vitamin B12, because part of the reason why, for instance, alcohol has such a detrimental effect on the brain and the nervous system is that in chronic amounts, it really affects how you absorb and into your body and into your system vitamin B and vitamin B12 and folic acid. So I know that this sounds very generic, but having a balanced diet, I think she already mentioned omega, which is kind of like fish and fish oils and a lot of vegetables. And really, I know it again sounds really fairly generic, but outdoors, there was a really good recent big literature research paper that said something pretty obvious, but it's true that if you are out in green, fresh air where it's not polluted, it's actually better for your brain. If you have I wouldn't specifically go and get saffron.
Thank you.
And somebody mentioned martial arts, didn't they?
Yes, there was a question about martial arts.
Yeah, I think martial arts actually, in terms of sport, there's a lot of movement and a lot of, like people, or what I know of it, but it's not impact on your brain. The thing that affects concussion, if you think of things like boxing, if you think of football where they head the ball quite a lot, if you think of rugby, or if you think of sports where the head has to move very quickly, so like that acceleration and then deceleration bit, or it's going backwards and forwards. So martial arts on the whole, actually, which I presume actually if it's your child, they're probably being taught by a professional, it should be fine.
Yeah. And there's obviously different types of martial arts. So I know there's some that can be contact, but many are not. So it depends on which one that they are practicing. And of course, there's usually sort of safety equipment that they're supposed to use whilst using that to reduce the risk. Someone else has asked, my father died from vascular dementia. We're sorry to hear that. Is this hereditary?
Yeah, I'm terribly sorry to hear that actually as well. Vascular, if it indeed was vascular dementia and that diagnosis was correct, it is not hereditary. Vascular dementia, by the nature of it, it's essentially means that all those blood vessels over time, especially the smaller vessels, when they lose their elasticity, they lose their ability to do good supply to the brain. Over time, that brain tissue becomes more and more unhealthy. And then the blood vessels get more and more unhealthy and don't do their function optimally. So vascular dementia is not a hereditary dementia.
Thank you so much for clarifying that. But the thing is, what Dr. King was saying about making sure that we have a healthy blood pressure and living a healthy lifestyle can contribute to reducing the risk of vascular dementia, which has issues with the blood vessels that supply the brain, and therefore vessel health, which boils down to things like blood pressure, diabetes, cholesterol, physical activity levels, all of those things are really, really important. And we know as a community, that's something that we need to really work on. Now, someone has asked, I suffered a traumatic brain injury a number of years ago when I fractured my skull through a fall. Oh, I'm really sorry to hear that. My olfactory was damaged and I lost my sense of smell. And unusually, my taste ability was not affected. Is there anything I can do to regain my sense of smell?
I'm really sorry actually about that as well, because that sounds it's usually such an awful experience, isn't it? Because it comes out of nowhere. The olfactory nerve is a very sensitive to damage, and you've described it very well. My recollection of it is that I don't know how many years ago this was, but if you have not regained it, the sense of smell, after a number of years, they usually say it's very unlikely. The reason for that being that if it is damaged and it is starting to regrow, it usually grows very, very slowly, but you might get it back in something like 2 years or 3 years. If it is longer than that, it usually means that it's very unlikely, because the damage might have been such that there's no ability for it to start reconnecting and growing again.
Yeah, thank you so much for answering that question. So those are the questions that we have for now. So people can, I think we have time for a couple more. But just to kind of pick up on what you were saying, I think for our community, here in the UK, we know that Black people are at a much higher risk of strokes, and that's both ischemic strokes and hemorrhagic strokes. And we also know that this is something that impacts us at a younger age. And actually, when I was a more junior doctor, I worked on a neuro rehab ward at the National Hospital for Neurology in Queen Square. And, we had quite a few young Black people who had strokes that we were trying to support in their recovery. And it's just to kind of, I know we've already talked about some of the basics, but I just wanted us to kind of reflect on that and say, how can we as a community really try and reduce that risk, increase our awareness of the risk, and really work on trying to improve those outcomes?
I will say that I think what you say is very, very right, actually. And on reflection, when I think about the number of people that I have seen who have had stroke, and both types of stroke, as you rightly pointed out, it makes me one of the most striking thing, and I know I'm repeating this, but it is know what your blood pressure is.
That's right.
Know what your blood pressure is. Just to say, is my blood pressure within what my doctor, my GP, or my nurse, health nurse, is it what they would say is normal? And if it is not, what do I need to do to change it? And there's a number of different things. Of course, there's the pharmacological side of things, because actually, just worth also pointing out that in our community, we tend to have blood pressure that is difficult to control. And some of that might also be related to research and other things, but a very key thing is to know that. The other aspect is that we need to also, I would suggest, know what we eat, because a lot of diet and nutrition advice is geared or makes reference to food that is very, in my view, I would say it's not our community food. It's not what we cook and what we eat most of the time. So we don't have robust information about the food that we eat. And I'm not suggesting don't eat what you love and don't do it, but how can you make some small changes that would actually be healthier for your blood pressure? If you have things like renal disease, how do you do that? And I say this having looked after some individuals that needed that specific advice, and we were fortunate to have dietitians that were able to adapt and look at that. So that's a very major thing. Another thing that you mentioned, actually, which I think is a very important thing, is diabetes. We need to think about it, and then to be conscious it exists, it is there. And once you've got a problem with diabetes, do engage with how to manage it. And one last thing, if I may, I'll make a plug for this. Somebody mentioned something recently, and I thought that's very striking. You're very right. So I'm stealing somebody else's observation, actually. She said she goes to her local park run. And she said, I don't see anyone bringing, and as many people from our community bringing their children there. And I'm not saying all of us, let's all go and join park run, but the habit of doing some form of exercise, it doesn't have to be a gym. You don't have to invest in something that you're not sure you will enjoy. But if you walk, if we get our children to start getting into that habit, and that's a lifelong habit. Somebody said to me that whether you engage with it or not, health is a lifelong thing. And it's something that you should choose to. And also asking questions, ask our health providers things if you want to. Don't be a passive recipient.
That's right.
I'm not suggesting that we are, but we tend to have slightly more deference for medical professionals and health professionals. And sometimes when something is not clear, we hesitate to say, can I just clarify what that means for me?
Yeah. Thank you so much for that. And I really, say for example, salt intake in our communities and the seasonings that contain things like MSG,
Yes.
which is monosodium glutamate. I know that obviously as a community, we don't like tasteless food, which is fine. I don't like tasteless food either.
I say.
But it's about what kind of seasoning. So there's lots of natural herbs and spices. So always check, even with all these mixed seasonings, there's often a lot of salt in them. So again, that salt intake can really drive high blood pressure, particularly in us, because the way Black people have high blood pressure, salt is a very key factor in that. So all of the things that we're saying is diet, lifestyle. And if you are prescribed medication for your blood pressure, it's not a 1 month thing and you stop. You don't stop unless the clinician tells you you can. And that's another thing that we struggle with. If you're having difficulties with the medication, please ask, as Dr. King was saying, don't hesitate to ask. I've shared with many of you before about me having high blood pressure since I was 27. And at the time of when I was diagnosed, it was like 190/110. So I could have had a stroke at that level. So I was really lucky that obviously my clinical knowledge as a doctor helped me get that under control and save my life in the way that I see it. But it's really important that we understand that this thing's going to happen actually from a younger age in our community as well. So having that lifelong and introducing our children to that healthy lifestyle from a very young age is really important. So there's one final question before we hand over. Is about whether the Apple Watch counts as blood pressure checking.
I want to I'm increasingly interested in what digital things can help us with health and with everything else. I would suggest, I think it's probably reasonably accurate, but I would suggest that you get blood pressure measure. You don't have to see your doctor, you just see your nurse first. The reason why I'd say that is that the blood pressure machines in your GP surgery, they're regularly calibrated to make sure they get an accurate reading. And the reason I'm also saying this is that we all have different like the circumference of your arm is very different. And then you just need to just get it. If you then think, actually, my Apple Watch readings are fairly similar to what the GP surgery has said, then that gives you an indication. But at the moment, I don't think that they're as accurate as we would wish them to be, especially when your readings are high. So they might actually give you some false readings.
So that's the thing. And I think, I mean, my own Apple Watch only shows me heart rate. So I don't know if there are certain Apple Watches that also show blood pressure. But the problem with, is what she was talking about, Dr. King was talking about, which is calibration and things like that. I mean, there is a brand called Omron that sell home blood pressure monitors.
Yeah.
And you can get it at Superdrug. It's often on sale and it goes down to £20, but usually the normal price is £30. So you can check between Superdrug, Amazon, and you could potentially get that. That Omron brand is the same brand that is used in most practices, and you can monitor your blood pressure and review with the GP, because often even us as GPs we're now telling people to do their blood pressure at home because reduces the risk of having falsely elevated raised blood pressure because people are stressed. So I think what Dr. King has been really trying to get across to us is taking ownership of our own health and our brain health. So with all the things, we're always talking about it, but it doesn't make it any less true. So it's what we're eating, how much exercise we're doing, green spaces. And I love that she really highlighted that, because it's, for me, I often highlight it to my patients, green spaces are valuable, not just for physical health, but also for mental health. And stress management, sleep. We can't get away from the basics. And in our community, it's really important to really get that message across. It cannot be overstated or over-mentioned, because it really is the foundational pillars. So Dr. King, thank you so much for that wonderful talk. And thank you to everyone who's joined. I'm now going to hand over to Shola to take us through to the end.
Thank you.
Hello. Yeah, thank you very much again, Dr. King and Dr. Itsuno, for facilitating today's session. It was really, really insightful. So within CAN, we have a number of events and activities that is just as insightful and just as educational like this one. So I'm just going to be running through a slide of some of the things that we've got coming up within this month that would be of interest to some of the people on the call. I'm going to try and see if I can share my screen quickly. Don't know if everybody can see it. Yes. Can you see it, please?
Yes,
Perfect.
you can. When you're in
Okay, great. So our next Health Hour is going to be happening on the 29th of June 2024. We have this every Saturday between 11 a.m. and 12:15. So please, if you would like to register, the link would either be put in the chat or you can see it on the screen. You can also alternatively send an email to info@can.org.uk to receive knowledge from some of the Black doctors, just like we've received from Dr. King today as well. Also, we have a session called the Healthy Hearts that happen on a Tuesday between 6:30 p.m. to 8 p.m. And it's about our diet. I think in today's call, we've seen the importance of how diets can also be beneficial to our brain. And it's just, we're going to be having nutritionists talking to us about diet. And at the end of the session, we have a 30-minute physical activity led by our physical instructor at Khan. To register, please email events@khan.org.uk, or you can visit the link as we've seen on the screen as well. Also, we have a family and advocacy support session that runs every, I don't know how regular it is, but I think it's every second Wednesday of the month, just as it's been put on the date there. And we've been running a session regularly to deal with housing. So we've collaborated with the Manchester City Council, and for the last few weeks, we've been discussing housing and how that can, either affect your health and some of the things that you can do, to get knowledgeable about some of the things that you should do, potentially if you have like a mold in your house, or, just some of the issues that you might be facing. To register, please email advocacy@khan.org.uk, or you can contact some of the people that are some of the numbers that you've seen on the screen as well. Today is Windrush Day, and I think it was Dr. Itunu that was congratulating everybody at the park today. So please, if you're around in Manchester, where Khan is hosting a Windrush celebration day from 12 o'clock to 6 p.m. Today, it's at Alexandra Park, and entry is free for everybody. There's going to be Caribbean food, traditional dance and costumes, sports. There's going to be a Caribbean living room created as well. So to be great to see anybody that is living in Manchester come to celebrate with Khan. You are invited to the Black Healthcare Awards in London. It's the first to focus solely on Black healthcare professionals of the Caribbean or African diaspora. Please join us by celebrating their outstanding practice and determination. To get tickets, it's going to be happening at the Plaza Park, Westminster Bridge in London. To get tickets, please visit www.healthcareawards.can.org.uk. Saturday, the 27th of July in London. Also, there is going to be a lecture by Linda Sweeney, an historian in Manchester, talking to us about, Black people who have made Manchester their home. And it's going to be happening on the 25th of June. It's all in the spirit and the celebration of Windrush. It's going to be happening on the 25th of June between 6 to 7:30 p.m. It's free entry, and then there's refreshments as well. And it's going to be happening at the Race Center and Education Trust. Please email windrushday@can.org.uk for any inquiries, or if you might like to register, the link is also on the screen as well. Finally, we have a Young People's Forum that is happening on the 27th of June, 2024 at 6 p.m. It's happening online. And the topic for this session is going to be about financial empowerment. Please, to register, email healthandwellbeing@can.org.uk. With all of these events and activities I've been speaking about today, if you might like to get more information, please send info@can.org.uk an email, and we'll be able to direct you to any of the various activities or events I've just spoken about. We have a type 2 diabetes workshop. I think one of the things that Dr. King mentioned as well was how diabetes, could affect brain health as well. So we have a type 2 diabetes workshop, and this one is in person. It's happening on the 28th of June at 2 p.m. Please, to register, email albert@can.org.uk. There's a 50% compensation there's a £50 compensation for participation, and there's refreshments is going to be provided. It's happening on the 28th of June at 2 p.m. And people who can participate are individuals from the Black African and Black Caribbean ancestry or ethnicity, and if they're living with any type of cardiovascular health conditions, including type 2 diabetes. Thank you for joining us today, and we hope to see you all next week, Saturday, from 11 a.m. to 12:15. Thank you again to Dr. King and Dr. Itunu for facilitating today's session. And I'll pass it over to Natasha.
2 seconds, sure, I'm here. It's just my computer is doing the thing that I'd like to do.
That's cool. Should I stop sharing my screen?
Thank you so much all for coming. Yes, that was great, Shola. Again, thank you for your contribution today. Dr. Tuna, Dr. King, in this sunny day, joining us, really sharing your knowledge, your enthusiasm with our community. We much appreciate your volunteer work. And rest assured, it does make a difference. And I shall see you all that live in Manchester at Alexandra Park. Until next week. Bye-bye.
Targeted Health Improvement Program, CATHIP Health Hour. The Caribbean and African Health Network, CARN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating, and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members, and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses, and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell, and many more. We have not forgotten to include within our health hours the many societal, cultural, religious, and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, share your experiences, and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community.